in this particular video, because in last video we discussed about a cracked tooth syndrome, how did the patient present to us with that sensitivity, and then is not able, when he bites, sometimes the pain gets really aggravated and severe. So now let's look in this video what are the potential methods by which we can solve this problem. So this is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai Raja Namalapuram since year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out for you. So now when you look at this crack, if you have not seen our previous video, please do see the previous video so that you understand the methods by which this cracked tooth can actually develop. So what we actually took is, we took a CBCT scan. So in a CBCT scan, we can see the extent of the crack. There are two things that can happen. One, the crack can only cause a minor chipping of the tooth. So when there's a minor chipping of the tooth, there is nothing to worry. And usually it will be presenting as a sharp tooth. It might require just a polishing of the lost enamel structure. If that enamel and dentine are also cracked, it might require a small filling. The problem ends there. Usually the problem doesn't get repeated. So if it's a minor chipping of the tooth, just a polishing or a filling will help to solve the problem. But sometimes the crack is in the central fissure and the crack goes deep inside, and there's a lot of pain for the patient. So in this case, what we need to understand is, we have to see whether under local anesthesia, whether we can see how deep the extent of the crack is. If the crack is usually well contained within the tooth structure, usually doing a root canal treatment for the tooth and then putting a crown on the tooth will help to solve the problem and relieve the patient of the pain and prevent the crack from further developing. This usually solves the problem. But sometimes the crack can be so severe, it can go on to the root structure. Sometimes it can split the tooth into two. In that case, extraction of the tooth only will be the choice of the treatment. Trying to save the tooth is going to be very futile, because because the infection that can develop because of the crack can keep recurring again and again, creating a lot of trouble for the patient. So in that case, we usually do an extraction of the tooth, and of course later we can always plan a replacement for the extracted tooth. Hope you like this video. If there are any questions, please do ask in the comment section below. Until next time, Dr. Arun from Pearls Dentistry. Bye bye and thank you.